The coronavirus newscast in an hour. First, later than billed, Question Time on BBC One with Fiona Bruce.
Welcome to Question Time. On tonight's panel, Stephen Barclay, Chief Secretary to the Treasury and former Brexit Secretary. His opposite number, Labour's Shadow Chief Secretary Bridget Phillipson. His first job was on the railways more than 40 years ago. He's now General Secretary of the RMT Union, Mick Cash. Devi Sridhar, Professor of Global Public Health at the University of Edinburgh and a member of the Scientific Committee advising the Scottish Government on coronavirus. She joins us down the line from Edinburgh. An entrepreneur and author, chairman or owner of food chains such as Pizza Express and Patisserie Valerie, and a former chairman of Channel 4, Luke Johnson. Good evening. So welcome to you. Welcome to my guests here in the studio, socially distanced, and to Devi Sridhar, of course, joining us from Edinburgh. And so tonight we're going to take a combination of pre-recorded and live questions. And also I'll be bringing your questions and your comments via social media. So I'll feed those in as well. And of course, if you're watching at home, do join in the conversation at BBC Question Time on social media. Right, let's take our first question tonight, which is from Daniel Guest.
Good evening. I am starting a new key worker role within the NHS next week. However, my only means of getting there is by using public transport. What can be done to ensure that all key workers that have no choice but to utilise public transport will be protected both at work and on their commute?
Well, Daniel, first of all, congrats on starting your new key worker role. Mick, as head of the RMT, let me start with you.
Well, first thing I think we should do for key workers is make sure they can travel free on our network. You know, particularly NHS workers, they're actually providing a hugely important task. And what we want to make sure, us as a union and the rail unions have been sitting down working with the rail industry, making sure it's safe to travel on the network.
And do you think it is safe at the moment?
Well, some of the pictures I've seen in the last few days, no. With the overcrowding, with the congestion that's been on platforms and trains, no. We had a plan as an industry that the government threw into disarray when they decided to release the easement of lockdown so that we got more people using the railways than we planned for. And that's putting everybody who should, including predominantly key workers, at risk of travelling because there's overcrowding, particularly at peak time. So we want to make sure we have a regular service. They're increasing the amount of trains next week, so that should make it safer. If you've got more trains running with less people, you have the ability to have social distancing and keep safe. And we want to make sure that people feel safe and can travel, get to and from work. The rail network, bus network, have been operating completely throughout this crisis, and I think we should praise all those workers who have been doing that activity. One of the things I've learned from this particular crisis is the amount of people that actually ensure that we, as a society, can run and operate. That's NHS workers, care workers, transport workers, shop workers, and they all need to have the opportunity to get to work safely.
And can I just ask you, Mick, you've been reported saying that you'll recommend a strike if it's not made safer?
No, what we've said, and we've got some real concerns about overcrowding and the fact that you cannot have 2 metre social distancing on crowded trains. It's not safe. And
so this talk of a strike, is it correct?
No, what we've said is that if the trains are overcrowded, if our members are put at risk, then we're saying to them, like any worker who has the legal right to protect themselves, get to a place of safety and get out of harm's way. Because some of the things that we've seen, some of the message we've seen from the government is actually encouraging people, whether they think it or not, to get onto trains, make platforms and trains and buses crowded and putting those workers at risk. So we're saying, no, if you face like that, okay, step back. But that could mean, in certain circumstances, trains would be stopped.
Luke?
My wife works in the NHS every day at a hospital that has COVID patients. And she's wondering why, if she's having to do that, why rail workers, for example, who are, you know, the drivers are in their cabin. So why are they more at risk than the health workers?
Well, it's not necessarily that they're more at risk, but do you think they should be equally at risk?
Well, I don't know what safe means. When people say safe, do they mean absolutely safe in every possible way?
Well,
Is 2 metres social distancing scientifically proven to keep us safe? I think, you know, all this obsession about being safe all the time is not realistic in a busy city like London, is it?
I have to say, I mean, you need to get your facts right there because, you know, you're 16 more times likely to get coronavirus and die if you're a London bus worker than you are an NHS worker. And there's been 28 bus workers in London, 42 TfL workers die in London. There's been 10 rail workers and plus one British transport worker died of the coronavirus that we know of. And we know that there's a lot of underreporting in terms of the impact of the coronavirus.
So how are people to get to work?
Well, what we've planned to do and what we look to do is to make it as safe as possible. And we actually had a plan to do that. We had the situation where we've got 50% of trains operating at this moment in time. Next week, that was going to go up to 70%, and there's going to be a gradual increase. That would mean that you could accommodate more and more people travelling to and from work. And that has been put under a threat by the way the government have released a message about people getting on trains.
Well, let's ask the government. So Mick's saying they had a plan, but the government jumped a week early.
Well, firstly, congratulations to Daniel on his new job. And picking up on Mick's point, he talks about the capacity being low at the moment. So the first thing we need to do for people like Daniel is to get the services up and running to expand the capacity back to normal, so we have more trains running, more buses running, so there's more capacity. Then we need to encourage those who don't need to use public transport to walk, to cycle where they can. A very large number of people, 42% of people, their commute is less than 3 miles. If we can increase, particularly in areas like London, the number of people that are walking and cycling, that again takes pressure off capacity to help people like Daniel as key workers. The third thing we need to do is then have
walking
guidance.
or cycling to work?
Yes, in terms of in the House of Commons, quite often I would walk to work. And what we've done, coming back to Daniel's point, though, in terms of part of its capacity, part of it is encouraging others, and we put investment, for example, into cycling to encourage more cycling as part of that. But the third thing we need to do is then have guidance for people that are using the tube, support for some of mixed workers in terms of PPE where that's appropriate, in order that we can use that capacity as safely as possible. But there are alternatives. Cycling, we've seen a massive increase in the use of cycling, and that's why we put additional funding in to support that.
I'll just feed you some messages we've had in here. Ter is saying, is it inevitable we will face a second wave given the overcrowding we've seen on public transport? Elgar saying, after seeing a large number of people on the tube, should the government make it compulsory to wear face coverings on all public transport? Abid saying the scenes on public transport this week have been horrific, with people in tubes and buses crammed with no social distancing. In other European cities, I mean, in Berlin, in Milan, in Paris, they've introduced things on the metro, for example, where there are stickers saying where you can and you cannot sit, places where you can stand where you can't. In Berlin, you have to have a certificate if you want to go in during rush hour, for example. Is that something the government is considering?
Well, in the guidance, there's lots of sensible things we
like
can
that.
encourage people to do. So use contactless payment, for example.
No, but there's nothing like that in terms of social
One can't
distancing.
legislate for every single fact of life in every single circumstance. But there's
Stephen,
lots
that
of
was the sort of
common
stuff
things that can be done. Face coverings, the advice on SAGE, is for things such as public transport for very short periods of time. It is something that they're now recommending. But there's lots of measures in the guidance, such as contactless, that can be used. But the best thing to do is to increase the capacity. That's why we need to see, for example, in London, TfL getting more tubes running than they have at the moment. We're in negotiations with them to do so. That's also why we put 3.5 billion additional into the rail in order to, again, get that capacity going.
But can I just say, that was the sort of plan that we had about increasing capacity, but also putting a key messaging out. But the government jumped the gun. I mean, to turn around and say, we can get them onto bikes, sounds like it's from the Marie Antoinette School of Crisis Management. Let them use bikes. That ain't going to solve our problems.
You said yourself, Mick, that services were at 50%. The first thing for people like Daniel, who is trying to get to work, again, It's not just about London, it's about, for example, light rail in many of our cities, getting that light rail capacity that is used by many key workers. And the key thing is to get as many of those services. We have put funding in to do that, but we need your
Why did you jump the gun?
that.
Why did you turn around when we sat down and worked it, spent 2 weeks of hard work making sure that we could have a plan for over a period of time to allow proper services, safe services? Did the government jump the gun? After the Prime Minister's speech on Sunday, we saw an increase in usage on the rail network, and we saw people, our members, actually have to deal with real problems about passengers. We had one example of a passenger crying because she was worried about an issue of social distancing on a train where it had too many people turned up because of what the Prime Minister said on Sunday. We hadn't expected that. We'd done a deal last week which had an incremental change, a phasing in of improvements on train services, increased capacity, but also allowing a safe increased capacity, and the government jumped the gun. It's like the left hand doesn't know what the right hand's doing.
Okay,
we're talking to DfT. Are they talking to Number 10?
DfT being the Department for Transport.
Yes.
Let me just bring in Devi in Edinburgh. Listening to all this, what's your view?
Yeah, I just think it's quite tragic that we're in this situation. I mean, this issue about safety and all this could have been dealt with many weeks ago. Other countries have stayed open, they've stayed safe by actually having public health infrastructure in place to actually detect who has the virus, that when you do travel, you know that actually you're not going to be exposing others, that actually we know who has the virus and who doesn't, and we can make sure they're isolated. So I guess listening to this debate, is it safe currently to go on public transport? I don't think so. Is it safe to open schools? I don't think so, because we don't have in place the basic building blocks of surveillance to actually know who has the virus. And if the lockdown basically, starts opening up now before we have the infrastructure in place, it's basically pointless, in the sense of actually you should use the time to build the infrastructure so that actually when you lift lockdown, then you're in a better position than you were when you went in. And the thing I'm trying to get my head around is in the past 8 weeks that we've been in a lockdown that is costly, that is crude, that, very drastic in terms of the economic and social effects, as well as the effects on the, non-essential services in the NHS. What has fundamentally changed in the past 8 weeks to put us in a better position to open up? So what we're going to see is cases are going to go up. We expect now the virus is going to continue spreading, and in a few weeks we're going to have this exact same debate again, and it just feels like it feels quite tragic.
Bridget, would you travel on the tube at the moment?
I think this comes down to the need for government to provide clear guidance to all of us. It isn't just about individual choices, and what we saw on Sunday with the Prime Minister's statement and what followed was an unfortunate pattern of confusion that I think has left a lot of people wondering what the right thing is to do. It is quite reasonable that all workers should expect a safe working environment, and that has to be done carefully, it has to be done properly, it has to be worked through with those affected, with trade unions too. And I don't think giving people such little notice that they could return to work has helped in that way. There's also, of course, the big issue that lots of workers face real problems around what that will mean for childcare while schools remain closed in large part, other than to key workers, children and vulnerable children. The government's response to that is to expect employers to just negotiate that on a case-by-case basis. Now, of course, the vast majority of businesses and employers will want to do the right thing and they're responsible. But I don't think such big decisions that have an effect on all of us can be left so unclear. I think we needed clearer direction from government, and this confusion, I think, has been really costly.
Specifically on transport, do you think it's too early then to be opening up the economy for more workers to be going on public transport? Do you think that's too soon?
We recognise that there needs to be a phased move to greater economic activity once again.
Do you think it's too soon now?
Well, I think it is unfortunate that the Prime Minister made a statement on Sunday with no guidance to back that up, without a clearly thought-through plan about how that could be achieved. I mean, we've heard this evening from Mick that if the government was to work more closely with trade unions, with businesses, and to try and find a more sensible way of doing things, I think that would leave people feeling safer, because it's not just...
So it is too soon then at the moment?
No. What we want to see is it to be done in a careful and gradual way. So yes, where people can avoid public transport, they should do so. Steve is right to say that, but it shouldn't rest on individuals simply making that decision. We do have personal judgment and discretion, yes, but the absence of clear direction from government is damaging.
Luke, your big sigh just came from you.
Is it? Oh. Well, I think one of the unfortunate things that's happened is that the country has got petrified. We're the most nervous large nation of any. So the government's propaganda has frightened us rigid. And
I mean, it does look like we have the second highest deaths at the moment, so people maybe have
yes,
good reason
but if
to be
you
scared.
are, how many people who have no other morbidities under the age of 60 have died from this illness?
Who have no other morbidities?
Yeah.
Because I can tell you how many people under 65 have died. And obviously some
Under
of those
60,
with other
no other
morbidities may well have
morbidities.
survived. A morbidity doesn't mean you're...
350. You're more likely to drown. There's 400 people a year that drown, right? So I think we have to get things a bit in context.
What comfort would that offer to the families of those who've lost loved
Every
ones?
death is tragic, but believe me, we're already in the largest recession for 300 years. In fact, it's not just one recession. The Bank of England have said the economy will shrink by 14%. That's the equivalent of 2 recessions. It's a depression. And I wouldn't be surprised if we have 2 million more unemployed people within a year. Imagine the agony of 2 million more unemployed people. How many deaths might flow from that? How many deaths are flowing from the fact that we've got half as many A&E appointments at the moment? Cancer patients not being seen, people with heart disease not being seen. And the collateral damage of this campaign of fear and lockdown has to be taken into account. Very soon, I believe, lockdown will be causing more deaths than the virus.
And just to be clear, so in terms of deaths amongst those under 65 in total related to coronavirus, it's over 4,000.
Yeah.
Obviously, some of those
under
with
60, I said, under
sure,
60.
OK, but some of those with comorbidities, it's not necessarily that they were going to die anyway, they just have other conditions that they live with. Daniel, I'm going to come back to you in a minute. Devi, you were shaking your head there.
Yeah, again, I just want to come back to the point that we keep putting the economy versus public health, and I think that's a mistake. These are both on the same side. Containment is good for public health. It is good for the economy, and that's what we're seeing from the countries that moved early, that locked down fast, that actually took the drastic measures, contain the virus, and then are able to open up now. And I think having these kind of debates in February and March is what has created such confusion. So what is the government's strategy? Is it to let the virus run through, try to stay within NHS capacity, and basically think that's going to save the economy? And we're learning that's not the right way. The right way is actually to get on top of this virus aggressively. We have to stay in lockdown longer, do it right, ease it, and it's a one-way street. Right now, the problem we're going to face is if we open, it's not like the virus magically disappears. It's going to still be around. And so what that means is it's going to continue spreading. At some point, NHS capacity is going to be strained. We've already lost 60,000 people. I guess we're maybe 10% the way through this. If we're fortunate, we'll find out soon. We have a long way to go. And the way to do this is actually to stay in lockdown, get out properly. It's a one-way street, and stop putting the economy versus public health. They're both on the same side.
Let me come back to Daniel. Daniel, so what do you think of what you've heard? I mean, coming back to your original question about public transport.
I think, firstly, there is absolutely nothing wrong with trying to keep as many people as safe as possible. But secondly, I think we keep hearing a similar rhetoric from people like Stephen and others in government. But the fact is that some of our public transport are still crowded. That means that we need more action, and the government needs to work collaboratively with trade unions and other parties to try and solve this.
Steve, you want to come back in there?
Yeah, well, I mean, the whole point of the government strategy has been to get the R down, and thanks to the efforts of the British public, we have done so. That, through the scientific advice, has now enabled us to have a gradual phasing, which is what we've set out, where we have a gradual phasing where we switch back on the economy, with retail in June, with areas like hospitality in July. But it is conditional. It's conditional on us keeping that infection rate down. And where I do agree is it's not a choice between health and the economy, because a second peak of infection would be hugely damaging from an economic point of view. The Governor of the Bank of England was saying a very similar point last night in terms of the effect that would have on public confidence. So we do need to get the infection down. That is why we've taken the unprecedented measures, but we now need to have a phased approach to the economy, conditional on keeping
we may well come back to the economy shortly. Let me take Daniel, thank you for your question. Let me take a question now from Samantha Granger.
Hello. One of the most important things about managing this crisis is the clarity of communication by the government. Following the release of the new key message by the PM on the weekend, does the panel feel that stay alert, control the virus, save lives has any real meaning for the public?
Does it have any meaning for you, Samantha? What do you think of it?
I think it's a lot vaguer than the original message. I think it's really confusing, and I think it's very hard to get any clear message over to the public with this.
And do you think, I mean, I'm just wondering, is that inevitable perhaps when we're moving out of lockdown, that things will be slightly more woolly, for want of a better phrase?
I think the message has changed too quickly. I think changes could have been made without rushing ahead in the way that I feel this is.
Has it changed what you're doing, out of interest?
I'm actually shooting, so it makes no difference to me.
Right, OK. Well, Stephen, there's been a lot of talk, hasn't it, about the message. There's been a poll out, a YouGov poll, suggesting that 30% find the new slogan, let's call it that, unclear, whereas 90% found the old one much clearer. You can't be happy with that.
Well, there's no question that the slogan "Stay Home" was hugely effective. Leap would say too effective, because polling is also showing that the British public are more fearful of the virus than other Western societies, even though it's the same virus that we're all confronting. Although our focus group shows that actually the new message has also resonated with the public, and I think we've got to treat the public as adults.
What does that mean,
in terms of understanding? Because people do understand.
Because you've got 90% in this. There's only one poll suggesting they find it unclear.
I think we've got to treat the public with respect. And I think the public do understand that what we're saying is we need to apply common sense. Those who can stay at home do stay at home. Those who can't and need to work do so. They work with their employers. They then put in measures to ensure that those workplaces are COVID safe. And I think the way the British public have responded shows that they get this. They understand what the message requires. That's why we've had a very successful lockdown in getting the infection rate down. And we now need to continue that. And I think the British public understand that.
Bridget, do you support this message? If not, what would your message be?
It was always going to be more complex in moving to this next stage as restrictions were eased. And I appreciate the government have a difficult job in communicating the next phase of what happens. But I think that's why it's so unfortunate that we've had such confusion in the last few days. You know, with the announcement on Sunday from the Prime Minister, with the delay that then followed in there being proper guidance, with further guidance to follow. And this is just the start of what will be a really challenging process. You know, the government are moving towards looking at a phased return for some children to school. Again, getting the communication on that right will be absolutely crucial, but it will also involve parents feeling confident in sending their children back to school. We will need to make sure that school staff, all school staff, are confident they have a safe working environment, because if we don't get that right, it will mean that children don't return. It will mean that lots of people feel extremely anxious and worried about what the future will hold. Of course, the reason for some of this worry is quite legitimate, in that our testing rates are still far too low. The government has consistently failed to meet its targets around testing. Testing is, of course, not a strategy in and of itself. It is a means to achieving an outcome. But if we're going to move through this process, if we're going to trust the British people to exercise more judgment, then we must have clear messages from government around what that involves and what that looks like, and also a move to a much stronger position on testing, so that we can all feel confident that what's being asked of us by government is being informed not just by the best medical advice and scientific advice, but that we can be safe when we go to work, when we go around our business.
And can I be clear, in terms of Labour's position, are you supporting the Conservative government's position in England, which is to ease a lockdown as it is at the moment, or is Labour more supportive of the Labour government's position in Wales, which is obviously to keep the lockdown in place?
Throughout this process, we've said that we'll work constructively with the government. We want the government to succeed because it's vital for the country at a time of national crisis that we have that constructive relationship.
So
we've also
what,
said,
the Welsh are wrong?
No, it's not. No, certain areas are devolved. Of course, it would have been better if all four parts of the United Kingdom had been able to move in lockstep, and it's disappointing that the Prime Minister wasn't able to secure that consent. But what we will need to see is much greater testing, so that we can be confident that all of these measures don't see an increase.
I hear you. You made that point very clear.
Just
to be clear of your position, you support the easing at the moment. I know you're unhappy with the messaging and the lack of communication with the unions, but do you think the right decision has been taken by the government this week to begin to lift the restrictions?
There was always going to come a point where restrictions were eased. What I think is unnecessary is
is it right to be this week?
Well, I think it's unnecessary to put arbitrary dates on that and to rush it when you don't have the proper guidance in place. We've seen the impact that has had on public transport. We've put an arbitrary date on the phased return of school reopening for some children. It's better to get it right
I'm still not
than
clear
to
if you
rush
think
it.
this is the right week. I'm sorry, maybe I'm being...
Well, it's not. The government are the people that are relying upon the evidence to determine whether it's exactly the right point. It is not for us to provide an alternative narrative around that. What we will do is back up the government where they're getting it right and be critical and offer alternatives where we feel that they aren't. So on testing, on the lack of PPE, on the big problems we face in social care, on the fact that a lot of school staff are worried about what's coming. The government has to take the public with us. I agree with Steve, it involves treating people like adults. But if we're to do that, there has to be openness and there has to be transparency.
Can I just clarify a point? Because it's not that we've put arbitrary dates. We've said it will be informed by the science, informed by SAGE. It'll be conditional on what the infection rate is. And in testing, today we've seen the highest ever level of testing. We've seen a massive ramping up of testing, 120,000 tests today. You're right, testing is important, but we've massively increased that as a result.
126,000 tests. How many people were... 127,000 tests. How many people were actually tested?
That's how many were tested today, 120. That's the results of 127,000.
No, I think you'll find it's 76,000 people were actually tested. 127,000 tests were carried out, but 76,000 people. 71,600 people were actually tested.
That's right.
So not 126,000 people were tested.
That's how many tests, 127,000 tests.
Yeah, but just because it's important, because it's about people here, it's not just a test in itself, but 71,600 people were tested. I just want to clarify about this poll is that 30% find the new slogan unclear, 90% found the old, find it clear, 90% found the old slogan clear. I just want to make sure I've got that right. Luke, listening to this, I mean, this is about the message, but you feel that we shouldn't be in the lockdown at all, don't you?
I tell you what most disappointed me about the Prime Minister's speech, which I do think was vague, and I wasn't really paying attention to the message, was the fact he repeated the line that I think was a figure first put about by Neil Ferguson of we've avoided 500,000 deaths. I don't think this country was ever facing 500,000 deaths. I think that was a ludicrous exaggeration. I think it was scaremongering.
Well, it was 500,000 if nothing was done.
And a bit like Sweden. He was estimating about 10 times the number of deaths they've had if his model had been followed. And I don't have a great deal of confidence in a lot of the advice that the government's getting, I'm afraid. And so I think that's my problem with his speech.
Well, let's ask Debbie, because you're giving advice to the Scottish Government. What's your take?
I think people are fearful because they don't know where the virus is, and they're looking around at their neighboring countries and seeing other countries seem to be on top of it. A clear way to actually figure out how on top of it you are is through testing. So if you're testing people and less than 2% are positive, you know you're in pretty good shape. This is where South Korea and New Zealand are. If you're testing people and it's around 5%, you know you barely have a handle on it. If it's over 10%, you have a huge problem, and we're finding that we're over 10%. And of course, this leads to actually the question of where is this virus? I think what we need is actually clear information and local information on actually what is transmission in different parts of the country. If you know that there are parts of the country where transmission is very low and there's a low number of cases, then obviously it's safer for people to go out, and you can share that information, and then people actually know this. This is the strategy that many other countries are taking. And just to note on Sweden, that actually Sweden has one of the highest death rates per million in the world, and far higher than its neighboring countries. And it still is taking an economic hit.
Yeah, but not higher than Belgium or Holland.
And they themselves have said that actually that they have not protected the elderly and the vulnerable. That's a moral question.
And can I just ask you on Luke's point about the 500,000 predicted deaths if nothing was done in this country? That's 500,000 over a couple of years. Luke
he didn't say that. He just said
you think that's nonsense?
I think it's scaremongering.
Do you think that was nonsense, Devi?
Well, let's just look at the numbers so far. We've had 60,000 estimated deaths. We are probably 10% of the way through this. If we think we reach some kind of immunity at 80%, we basically have to lose 8 times that amount. So actually the figures are slightly lower than the ones estimated, but they're still incredibly high. It's a lot of people that we would lose if we just took that strategy, rather than actually trying to suppress the outbreak, wait for a therapeutic, wait for a vaccine, and actually be able to...
When did they discover a vaccine for AIDS?
We have antiretrovirals for AIDS, so actually...
Yeah, but how many years did that take?
...allows people to live.
Before, Mick, I'm going to come to you. I just want to play in one other clip, which is on the similar subject, which is Jane Fallon. Samantha, I'm going to come back to you, but let's just hear from Jane Fallon.
As a grandmother, I'm unable to enter my grandchildren's homes. However, as their childminder, I would be able to enter their home and they may come to my home. Please, can the rationale for this be explained? Perhaps it's purely financial, as one does not allow their parent to work. That's me, seeing my grandchildren, spending a little bit of time with them, whilst the other does. Garden centres have been permitted to open as they're beneficial to mental health. But surely, seeing your family is even better for your mental health. And I'm saying this as a grandmother to 8.
So Jane just doesn't really understand why you made the decision you had. I'll come back to you, but Mick, let's hear from you.
You know, I watched. It was billed as something really important, the speech on Sunday. So, I mean, I might have had more people watch it than EastEnders. I don't know.
It's about 30 million, I think.
Yeah, you know, and
I've got that wrong, but I think it's 30 million.
I sat down and I watched it, and I turned to my wife and I said, "What did he say?" That stay alert. I think I've been alert for quite a period of time. Why he wants me to say stay alert, I don't know. And then we find out dribs and drabs. The following few days about other easements about what you cannot do. The example there, I've got 3 grandkids. My wife and I have had the same debate, and we haven't been able to see them. You do Skype and FaceTime and things like that, but there does seem to be an inconsistency. There's an inconsistency back into the point that you can go to a park and keep. So it's okay, good to go to a park now, but keep 2 metres away from somebody. But you can get in a jam-packed bus or train. There is a lot of inconsistency in what the government is saying. Can I just pick up on something Luke said to me earlier on? Earlier on. It's worrying me about this whole debate about Luke's rationale. I'd like to know what you mean by campaign of fear, because all the issues that we're raising, the concerns we've got, people are dying. I've had members of my ring on. We've been on the railway with me for 40-odd years, and they were saying when this first started, and the government got it right, stay at home. First started, I don't want to go to work, I'm frightened. I'm frightened for myself. I'm frightened that I'm going to go home and pass the virus on to my wife and her elderly parents. People had the right to be fearful of what's going on because it's a deadly virus. And I just wonder, coming out of this, whether the government has got it right, and it hasn't got it right, but why it hasn't got it right, and why they haven't put a clear messaging and a clear timetable so that we understand where this is going to end, as much as how you seem to, they bludgeoned into this, and they seem to be bludgeoning out of it.
There's certainly... Samantha's accepting, who asked the original question, that it's going to be more complicated now. And you talked about testing, and we've got the 126,000 tests, 71,600 actually tested. In terms of messaging and making that clear and transparent, do you feel you're actually winning that battle at the moment?
Well, it is very difficult for families, and we recognise that, I think, for all our families where there's grandparents not able to see grandchildren, and that is one of the heartbreaks of this crisis. But
we need to get... When you hear Mick saying, you can meet someone in a... if we're meeting in a park, it needs to be at 2 metres distance, but you can cram onto a tube or a bus with somebody, and you don't... You're advising face coverings, but it's not mandatory.
Of course, it's about having a balance, and what we're trying to do is limit the amount of travel on public transport, but we are trying to gradually phase back the economy because, as Luke alluded to earlier, the economic damage that is caused as a consequence of that. There's health consequences of the fall in GDP and the impact to the economy. There's health consequences in terms of wider treatment other than COVID within the NHS. So it's important to have a strong economy to pay for our public services, to support people's health and well-being, and phase part of that. But the bigger risk to the economy, the bigger risk to the UK is a second peak. So we're trying to do it in a measured way, in a balanced way. The risk, as Sage advises, of transmission outside is less than it is inside. That's why the advice has been shaped in the way it is. But it's conditional on continuing to keep the infection rate down, and that's why it's a very gradual approach.
Well, you talk about the economy. We've got a question about exactly that from Aaron Jones.
At the start of the COVID-19 crisis, we were informed that a mortality rate of 20,000 would be a good outcome. This has been exceeded. It has also been reported by Professor Spiegelhalter that of the unexpected deaths, there is a greater proportion of non-COVID deaths than official COVID deaths. Given this, how do the panel rate the government's performance, and has the pill been worse than the ill?
So, Luke, from what you're saying so far this evening, you think the pill has been worse than the ill?
I think there's a grave risk now that as we enter the 9th week period of lockdown, that will be the case. Yes, virtually every other European country is now opening up. Schools are open, businesses are trading, even restaurants and bars are opening in many. And yes, they're practicing social distancing, but clearly they've got the same virus that we have. And yes, some of them have perhaps done testing better than we have, and maybe they've treated patients better than we have, but overall they are similar, and they are obviously taking a view that they can keep the virus under control and keep the deaths to a minimum. As Stephen was saying, that you know, the collateral damage in so many ways, the unintended consequences of lockdown are so severe that there really is a ticking time bomb in mental health terms and in so many other ways, in the impact on our children's education, that it's not something we can possibly be undertaking lightly. And there is one other thing I'd like to say, which I'm afraid to say is a characteristic of this programme. So there are 5 of us on the programme, and I would say 4 out of the 5 of us are in the public sector. I'm the only one in the private sector. Actually, in terms of the shape of the economy, 85% of the people working in the economy are in the private sector. And no one here today is going to lose their job because of COVID. But believe me, there's a real risk that millions of people in the private sector are going to see their careers demolished. And I think that really matters. And people say, oh, economics over lives. Unemployment can kill people. And I think it needs to be taken into account. And also, how are we going to pay for the £170 billion a year that the NHS costs us if the economy's in the toilet?
I'd just say, because we are a political programme, we're always going to have at least 2 or 3 out of 5 being politicians.
Facts right, though,
that's just, it is, but in fact, we're a political programme, so that's why it is. Let me just be clear, do you think we shouldn't have had a lockdown at all, then?
I think Sweden's done all right, and time will tell. But I think they've done all right, and they didn't have a lockdown.
Well, they say they've had a bit of a lockdown. Obviously, their deaths are higher than neighbouring Norway, for example.
Yes, but lower pro rata than Belgium or Holland.
And the effect on the economy, though, in Sweden?
Yeah.
I mean, they took the central bank today saying that they think the economy could retract by, what, between 6 and 9.
Yeah, it still doesn't compare to 14, does it? Which is what the Bank of England is saying about ours falling. I'd say their economy will suffer half as much as ours. And unemployment so far, in terms of the increase there, has been minimal.
Bridget?
The level of deaths is tragically high, and behind that number is a family devastated by grief. We supported the government going into lockdown. It was the right thing to do. We've also supported the government and have called for many of the measures that they've brought forward to provide support to workers and businesses to try and get through this crisis. In some cases, we think there needs to be extra clarity, further changes that are needed in order for us to... Sorry.
It's classic. A phone's gone off.
Sorry.
Come on, Mick, sort it out. But in terms of the question, is the pill worse than the ill?
I don't accept that it's a choice between saving lives, public health and the economy. The lockdown was necessary to save lives. We have unfortunately seen we have amongst the highest death rates in Europe. That is deeply regrettable and has caused grief and heartache for so many families. That's why it's so important that what comes next is right, both in terms of testing, also in social care, where we know that testing isn't where it should be, that far too many social care workers are not getting access to testing. PPE, unfortunately, still remains a problem. But there is a lot of anxiety around what will come next for the economy. That's why we support the government in taking the steps that they have to protect jobs and living standards in businesses. But there will now need to be conversation around what happens next. So yes, job retention, but also job creation and a plan to get the economy moving once more.
There's another message has come in from David Colby. Why wasn't strategy built around the mortality age profile? This plays a bit to what you were saying, Luke. Only furlough staff over 50, especially males. That would be you then, Luke, who are twice as likely to die at that age, so you wouldn't be working at all. Throw the sink at protecting the elderly. You're 500 times more likely to die at 80 than 20, so protection should be tailored. This is what David is saying. I can't verify that fact exactly now. Stephen, do you have any sympathy with what Luke is saying?
Well, I think what
there shouldn't have been a lockdown at all.
Well, no, because I think it was important that we protected the NHS. We saw the scenes in countries like Italy where their health system was under massive sustained pressure. And one of the successes so far has been in protecting the NHS and ensuring that it has sufficient capacity to meet the number of patients that have been coming in.
But just coming back to one point in Aaron's question, he says at the start of the COVID-19 crisis, we were informed a mortality rate of 20,000 would be a good outcome. So that mortality rate of 20,000 was predicated over 2 years. We're now 2 months in, and our mortality rate is north of 30,000. So do you think the strategy has been right?
Well, the strategy has been right in terms of protecting the NHS, but what Luke was talking about was
the NHS to save lives, not just for the sake of it.
And the capacity in the NHS has enabled us to ensure that it hasn't been overwhelmed in the way that some other countries in Europe have been. But Luke's point was around the economy, and what the OBR has said, what the CBI has said, what the Bank of England has said, is that the measures we have taken have prevented economic scarring, that there would have been much more severe economic consequences, many more jobs lost if we hadn't introduced things like the furlough scheme, protecting 7.5 million people now at a cost of £10 billion, just under 1 million businesses that are having their staff protected. The measures we've put in place with the self-employment support scheme on its first day, 440,000 applications. So we've taken decisive, quick action to protect the economy, because yes, it is expensive, the measures that we put in place, but the alternative of not doing so would have caused much more economic damage.
Mick?
Well,
the pill worse than the ill?
Sorry?
Is the pill worse than the ill? That's the question.
Well, I just wonder whether we're in a position where, you know, how we got here in the first place. You know, after 10 years of austerity, as a country, could we be better prepared for this pandemic, and whether or not we should have been in a situation that we reacted too late? Was there complacency? Because some of these questions are material to actually how we've handled the crisis since. And my sense is no, we were complacent at the start of it, and actually, as a country, austerity, including on the NHS, on care homes, on the civil servants. I know some key fabrics of this country have damaged our ability to deal with this crisis, and it's going to damage our ability to get out of this crisis. So some of the seeds of this and the reason why we're in trouble go way back, and previous decisions by previous governments, predominantly Conservative governments, I have to say, and that's why we're in the mess today and trying to deal with this issue. We haven't got the fabric, the social fabric, the infrastructure that we should have had if we hadn't had 10 years of austerity.
It's actually the opposite. It's because we took the decisions we did over the last decade to get the deficit down.
That's a load of tosh.
We've been able to have the level of borrowing that we have to actually meet the challenges that we face. It's a consequence of those decisions that we're now able to step up and put in place schemes like the furlough scheme that have protected so many workers.
So the fact you had to hire so many more extra nurses and try and get people come back out of retirement, that wasn't a function of the fact that...
Well, it's an unprecedented case. I mean, this is an unprecedented case.
But nonetheless, we were down on the numbers, weren't we?
But the fact is we've done that without NHS capacity being exceeded. We have met... There was a lot of talk on programmes like this about ventilators, that the UK was going to run out of ventilators, run out of capacity. We've been able to meet that capacity. But to Mick's point, it is because of the decisions taken over the last 10 years on the public finances that we're now in a position to put in place the economic measures, including the borrowing that we have done.
We've also seen social care consistently overlooked, and that is a problem now where we face a real challenge within our social care sector, not just in protecting workers who are doing incredible work looking after some really vulnerable people at this time, but also the unacceptably high death rate we're seeing in our care homes. And that comes down to the fact that we haven't had a proper plan to resource social care, to train the workforce, and we're still no closer to seeing that. The decisions that have been taken over the last decade have left us ill prepared for this. We'll be constructive in working with the government where they get things right, but we have to be honest around the fact that our public services were not resilient enough, and family finances are not resilient enough either.
Let me bring in Devi, who's listening patiently in Scotland. Now, Devi, I know in terms of the question from Aaron, which is the pill worse than the ill, I know you support the lockdown, and there in Scotland you think the lockdown should continue. But you must also be concerned, surely, about the cost to the economy, not just in terms of jobs, hugely important though that is, but in terms of excess deaths connected to mental health, to deprivation because the economy is suffering.
Definitely. I mean, this is the stress that I felt when we went into lockdown. I mean, I was thinking about, domestic abuse, kids out of school, kids going hungry. It's very much keeps public health researchers up at night. This is what we wanted to avoid. I think to understand how we got here, we have to go back a little bit in time. 31st December, China notified the World Health Organization of a novel pathogen, and the clock started, and countries could prepare or they could not prepare. The easiest thing to do is to do nothing. Let the virus run through. Whoever makes it, makes it. The second strategy is use lockdown and release cycles. And so in March, because of what happened in Italy, it seemed like we had a sudden jolt and change in strategy from the first to the second to a lockdown that came very abruptly and actually quite suddenly. And then now we're trying to transition to what many countries went to from the start, which is actually core public health infrastructure, testing, tracing, isolating. This is what South Korea has done from the start. And this is why they've never had to shut down. And their death rate is actually in the low hundreds. So if we're looking at countries to emulate, I would not be looking up to Sweden. I would be looking to South Korea, Taiwan, Hong Kong, Australia, New Zealand, Norway, Denmark, Greece, and the list goes on.
OK, I'm going to bring in one more question, if I can, from Bertie Woodcock. Bertie, can we hear your question, please?
Hello. We've all seen the footage of overcrowded trains and buses in London this week. And whilst COVID-19 is a global problem, its transmission is a local one. Spain and France have implemented different policies for the different cities and regions of their country. The UK government says it is always guided by the science. So the question is simple. What science could have led the UK government to the conclusion that Scotland, Wales and Northern Ireland should have different policies, but London should have the same as every other region and city of England?
And Bertie, do you think they should be different, even within England? Or do you think everywhere should be the same?
The RA is different across the whole of England. You could be leading hundreds of Londoners to their death and starving businesses in areas like Cornwall, where the R rate is lower. I don't think we're ready to free anyone up yet, but we're definitely not ready to free London up.
Bridget, is there an argument for doing it at different rates across England?
I understand the point that Bertie's making. I'm just not sure how practical it would be in getting that message across to the public. I mean, there is a disproportionate impact of some of this in particular parts of the country and within particular communities. In my part of the world, for example, far fewer people have the ability to work from home. So that places an additional burden on people. We've also seen, of course, big differences in death rates amongst our black and minority ethnic communities, which is a cause of real concern. And we really have to look carefully, as we move to the next phase, about whether it's more dangerous in certain environments for some people over and above others, and making sure that we put in place steps to keep people as safe as possible. I'm not sure it would be possible to do what Bertie is suggesting. Of course, there are differences in approach in different parts of the UK. Some of that is necessary. But some of it, I think, is unfortunate, and I hope that the Prime Minister can seek to bring a greater national consensus to this so that we can all work together and try and defeat the virus.
I mean, one thing, Stephen, that would feed into what Bertie's saying in terms of should you want to introduce different easings of the lockdown in different parts of the country is obviously the test, track and trace programme that the government's pursuing. Matt Hancock said he'd have the test, track and trace system in place by the middle of this month. So I think that's tomorrow. Is it going to be in place tomorrow?
Well, he'll be making a statement to Parliament on that on Monday, and it will be rolled out from next week. And the pilot...
So it will be in place by...
It will be rolled out from next week, and the pilot has gone extremely well. on the Isle of Wight. One of the questions that was asked about the app was whether people would download it. More than half the people with smartphones on the island have done so. One of the other questions with it was whether privacy would be a big constraint, and yet in the feedback only 2% cited privacy because the data is kept on the phone until someone contacts requesting a trace. Now, whereas
just
Bertie's right,
want to be clear what you've just told us, though. Is it that next week Test, Track and Trace is going to be rolled out across the UK, or is it the app is going to be rolled out?
Matt to set out in a statement to Parliament, and Parliament, we get criticised if Parliament doesn't hear first, so he will set that out.
And you told us something's happening on Monday, so I just want to be exactly clear what it is.
He's making a statement to Parliament, as I understand, on Monday to take parliamentarians first, which is what the Speaker has asked us to do. But
in terms of Bertie's question.
To Bertie's point, so the R rate is compiled from 6 different scientific committees, so there's a huge amount of scientific peer review that goes into it. The tracing app will enable in the future as to look at where there are localised impacts. But we started the show with saying we needed simpler messages. Now what Bertie is saying is actually in the future we'll need to be more nuanced, and that's why we do need to trust the public. We do need to look at how we get as many people to download the app as possible.
What he's asking is there...
And then that will enable in the future is to consider what targeted action is taken on a much more localised basis.
So that's a possibility in the future?
So that it will again be subject to the scientific advice, but it is a possibility of the app that you can then be much quicker to react to flare-ups where they do occur and have a more nuanced message to the public as a consequence.
Mick?
Well, one of the things that's confused our members is that, we operate train services to Scotland and Wales and to all parts of the Great British Railways, and you've got to be careful. They can be a conduit, a way of transmitting the virus, and you don't want one arrangement in one part of the country versus another arrangement in another part. We had a bit of confusion and conversations we had when the Scottish Government said you should wear face coverings, well, face masks, face coverings, and that was what they wanted in Scotland, ahead of what the UK government were saying around England, and Wales are saying something different. So, in all of this, we've got to remember we're not one nation, and there's a lot of when you release the travel and allow people to travel more, you have to have consistency across the whole rail network to allow our members to understand what to do, as well as passengers. So we've got to be very careful in trying to have different arrangements for different parts of the country, because it could spread or otherwise.
And just out of interest, are you as a union then recommending that all your members wear face coverings when they're working?
We're actually in a position where we're saying that we believe it beneficial for passengers, users of the services, as part of the protections, to wear a face mask.
Sure, no, I appreciate. Also, you can't compel them to do so, but I just wonder what's happening to your members.
In terms of members have different activities, and they we're seeking to get them have face masks and visors to protect themselves. But some of the so-called PPE, is called, for face coverings, for example, doesn't protect the individual. It stops transmission, which is not what PPE in itself is made for, personal protective equipment.
Devi, obviously in Scotland you're in a different position in terms of the lockdown hasn't been eased, or eased kind of fractionally in terms of exercise. Coming to Bertie's question about having different easings of the lockdown in different regions or even smaller areas, does that strike you as a good idea?
Definitely. I mean, this is what I've been saying from the beginning, that we actually need to be looking at community level and seeing transmission and making sure that actually the economy and society are running where transmission is low, and where transmission is high, we try to get a handle on it. To come back, though, to the phrase following the science, the thing I really want to clarify is there's no English science and Scottish science and German science and Korean science. Actually, science is global. We have the same information here among our scientists as others in other countries, because we're working together as a global community.
So why do you think you're coming to a different conclusion in Scotland than the government is here in England?
Because they're political decisions. And so, for example, on the issue of schools, we can present in Scotland what we know as the information being on schools. We know children can transmit the virus to a certain extent. They are carriers. We're unsure of the degree. Most seem to have mild symptoms. There are a few rare cases of children experiencing very severe symptoms a few weeks later. That's what we know, and that's what we can present. Now, political leaders have to weigh that against the educational benefit of kids going back, against the economic effects of having working parents going back, and then looking at the consequences on the infection spreading wider. We can just present the evidence, and then they have to make a decision what they want to do with it.
Bertie, I can see you nodding away there.
Yeah, I totally agree with that. On Stephen's point, we've seen in China the quarantining of different regions and provinces. Is he saying that the British people aren't intelligent enough to understand that London
Quite the opposite.
is different to other areas of the country?
No, quite the
And in
opposite.
that
My point
simple
was that we
message-
can be more nuanced in our messaging. Quite the opposite point.
In that simple message, you're not leading to the deaths of hundreds of Londoners who live in a world of public transport and driving out loads of businesses that are in an area where the R rate is further down.
Well, actually, in London, the R rate is, as I understand it, is pretty low. Obviously, we started much higher, but at the moment it is pretty low.
But it wasn't when the outbreak began. And if we're going back to a system that's similar to when the outbreak was, that R will go back up. We can clearly see that there's more contact in London than in other regions of the country. And that's what caused the higher critical care bed percentage, the higher number of deaths.
Luke?
I think the government has an impossible task, and they're never going to please everyone. And the messaging, as Stephen said, is very difficult to get across well. I think that the more complicated you make it by dividing up the country and regions of even England, then the harder it's going to be to get compliance. And bringing in the example of China locking down regions. China is a communist dictatorship. They can lock down whoever they want, and they bring in the military to do it. So I think we are not a comparable society. We are a civilized democracy. And therefore, I don't think we can adopt the same sort of methods that they use in China, and it's not relevant.
Yes, I mean, in China, they're walled, well, they kind of seal people in their homes.
Is that what we want? I mean, as it is, we've given up more liberties than ever in the history of this country over this lockdown. And we shouldn't forget that we are a free society, and the way in which we've waived our rights so that we are under effective house arrest as a nation should not be taken lightly.
But in terms of, given that you're so unhappy with the lockdown as it is, can you not see any merit in easing it more in some places and less in others?
It might have merit, yeah. It's complicated, I think.
But it's what's likely to be coming down the track then, is it, Stephen?
Well, what I'm saying is one of the things that the Tracing Act will enable us to do is to react much more quickly to where there are any potential spikes in infection, and have much better data so we can get the testing in quickly and can respond quickly to those measures. And that's why it's so important we get as many people downloading that app. It's been successful in the Isle of Wight in terms of the number of people, and then as it's rolled out more widely, we need as many people to download it.
And did you say about half the population in the Isle of Wight?
Just over, my understanding, just over half of those with smartphones.
Because you need about 60% for it to be successful. Has it reached that?
Well, the data is useful at whatever percentage it is, but the Department of Health, as I say, will do a further statement on it on Monday, and will set out where that pilot's got. But the reports I've had is that more than half of the population have downloaded the app.
Well, maybe we'll all be downloading that app at some point. We shall see. Bertie, thank you very much for your question and for all the other questions, of course, that were fed in this evening. Our time is up. Next week, we're looking for questions from people living in London. And as you've seen from the programme this week, we are inching our way back towards having more of you live on the programme. The more, the better, as far as I'm concerned. The following week, so after London, the following week will be in Glasgow, virtually, of course. So do get in touch by going to the Question Time website and applying in the usual way. If you want to carry on the discussion, as always, you can join Adrian, Charles and guests on Question Time Extra Time, and that is on 5 Live right now. But for the moment, thank you very much to all of you, to my panel for coming into the studio. Devi, thank you very much for joining us from Edinburgh. Of course, thank you to everyone who recorded a question or got in touch via social media of the programme. But for now, until next week from Question Time, bye-bye.
One day, I will tell you there are no new cases.
And I'll read that the